But my mom also had, unfortunately my mom passed, it'll be 9 years in July. So what actually helped me is being prepared for all the different phases that she went through. So I realized that I could not be fearful of this. I had to be prepared as much as I could. So I actually went to the Alzheimer's website to find out a lot of information about what was happening to her, what was going to happen to her, and how I could protect her and help her as much as I could. One of the key things for her that I wanted to make sure I provided is to give her a quality of life as long as I could. But it also helped me a lot to know what she was going through, even though it can be different for every single person. One of the other thing that I would say to you is, as a caregiver, it is one of the hardest jobs you could possibly have. And I was actually talking to
Natalie.
I was actually talking to Natalie about, now that I look back at that time, I actually don't know how I did it, but I think one thing that did help me is the knowledge that I had of what was happening to her. Also, one key thing I want to emphasize for you is how you need to take care of yourself. A lot of times the caregiver is the first one to go before the person you love who has Alzheimer's or other dementia. So it's really critical that you actually take care of yourself and ask for help when you need it. So now that my mom has passed, I also still use a lot of the material to check in on myself mentally. So we actually have a handout that talks about the 10 signs of Alzheimer's. And I recently retired, but when I was in the office at work, I actually had them right beside my monitor. So every week I'm like, okay, check, check. I'm still good, check, check. And I often, I know all of us do this, anytime I kind of forget something, I'm like, oh my God, this is it, this is it. But it also helps to understand that just because you may forget a name or where you laid something, that is not something to freak out about. But there are clear, or where your glasses are, or you know, but there are clear signs that will help you recognize what's going on. And I also want to indicate that if you know someone or if you feel like you're going through it, you can still have a really good quality of life. So my number one goal right now is to avoid Alzheimer's as long as I possibly can, which means I have to do make a lot of healthy choices. I also have to be physically fit. So no matter what disease you have, it seems like exercise and being fit is the main thing that's going to keep us healthy. So hopefully after you finish your lunch, you can come over and pick up some material. We have a lot of information for the person living with Alzheimer's and also for the people taking care of folks with Alzheimer's. All right, that's it.
I'm Summer Curry. I'm with Carolina Senior Care. We're a unique program. We're a PACE program. It's a program of all-inclusive for the elderly. Our goal is to keep folks at home as long as possible. So we serve folks that are 55 and older. They have to live in one of 4 counties, Davidson, Davie, Iredell, and Rowan. We're actually building a new site in New Bern, so it'll cover that area. And you also have to be approved by North Carolina State Medicaid to need nursing home assistance. But our center, we offer activities during the day. We offer transportation to and from appointments, to and from the center. We may even be able to go get your Walmart orders and things like that. They play games, do activities. They're actually working on scheduling a fishing trip right now for some of the folks. So they do a lot of fun activities. And I think they do like goodwill trips and things like that. And we've got some interesting events coming up. We're doing a prom for our folks. And then we've got participation and employee appreciation day, so we do like a cookout and things like that. But our main goal is to keep folks safe. If they're able to live safe at home and then get out during the day, then they may have a relative to bring them to the center, or they may actually have the bus that goes out. Sometimes you may see the Carolina Senior Care bus that goes out. But just the Lexington Center covers 4 counties. So it covers Davidson, Davie, Iredell, and Rowan. So we have about 146, 147 participants Monday through Friday. We have therapy there, physical and occupational therapy, our own medical clinic. You get your prescriptions through there. So it's a very, very unique program. We're a Christian nonprofit organization. So if anybody knows of anyone that needs assistance, come to my table and I'll give you some more information.
My name is Catherine Powell. I'm the nurse healthcare coordinator at the Life Center. I'm here with Abby Sires and Leslie Craver with the Life Center. They are family and caregiver specialists. Is that right? Let's see, we are an adult daycare center here in Lexington, open Monday through Friday, 7:30 to 5. We offer respite and counsel and socialization for the participant, but then also the caregiver as well. We have, let me go back a little bit. We offer, like I said, socialization. We have different activities going throughout the day. We have a chef on site that prepares meals that can be modified per doctor's orders. The nurse there can give medications if needed and monitor certain medical conditions throughout the day. We have wonderful CNAs that help with their activities of daily living, whether it's bathing, shower, helping them use the restroom. They serve food. We don't typically feed. Our level of care is not feeding a participant, but we do serve them. Trying to think, we do, let's see, we do private pay, but also have grant assistance for those that live in Davidson County. Various different grants are available. And then we also have a contract with Providence Transportation. I know you've seen the buses through here. And we can offset the cost, with the Department of Transportation grants. So, we'd love for you to, if you're interested, come by for a tour. You call and just schedule one. But it's a wonderful place, fun. And also for our caregivers, we have support groups. We have a Parkinson's support group that meets this afternoon. It's the 3rd Thursday of every month, I believe. And then a caregiver support group, which is the 3rd Wednesday of every month. And I'm leading that right now. But I'm going to let Abby tell a little bit more about the Family Caregiver Support Program.
Hi everyone, I'm Abby. So Leslie and I, we sort of head up our Family Caregiver Program, and that is to sort of help you guys, the caregivers, get connected to resources within the community. We offer food vouchers through the ARPA, American Rescue Plan Act funds. So if you are in need of a food voucher, I think it's worth $200 to use at Conrad and Hinkle. We also have, as Catherine said, different support groups. I have one that I'm doing for grandparents raising grandchildren, and also that family caregiver support group. We also have an upcoming series called Powerful Tools for Caregivers. So that is going to be an educational series for 6 weeks, I think, that will sort of help caregivers sort of empower themselves, both for self-care and to give you tools to better care for your loved one. So that's sort of our goal as Family Caregiver Specialists, is to sort of connect you to the resources and tools that you need to better care for yourselves and your loved ones. Yeah. Thank you.
Good afternoon, good morning. I'm Christy Robbins. I'm from the Salisbury VA Medical Center, and I work with veterans. Is anybody in here a veteran? Anybody?
How about married to one?
You're married to one, okay. All right, so does he go to, okay, your son? Do they go to the VA for services?
At times.
At times, okay. So just so you know, I work with the Caregiver Support Program, and we offer services to veterans who have served during any era. And we have 2 programs. We have the Program of Comprehensive Assistance for Family Caregivers, which is a stipend program where caregivers can receive a stipend to provide care for their veterans. And we have the Program of General Caregiver Support Services, which is a program that provides education and support to caregivers. any caregiver can receive services through that program as long as they're providing assistance with activities of daily living or supervision and protection because of a neurological issue or memory impairment for the veteran. The veteran does have to be enrolled in the VA and receiving services from the VA. And we have lots of wonderful services that we offer to our veterans, to our caregivers of our veterans. We have a neat text messaging service to provide our caregivers that sends educational and motivational texts to our caregivers. Basically saying you're doing a good job, or how often do you get to hear that from your loved one? They don't think to tell you you're doing a good job. And so it's nice to get a little text every now and then just reminding you that you're doing a good job, or you get a motivational quote. And our caregivers absolutely love getting those text messages. Sometimes I'll get a little text message from a caregiver saying, I got the neatest text message today. Thank you for signing me up for ACME. And caregivers just love it. And I'm a coach, I'm a certified health coach, and during the coaching sessions, we focus on what matters to you, not what's the matter with you. And we focus on 8 areas of self-care. And self-care is a big deal when you're a caregiver, isn't it? You know, you forget to take care of yourself when you're a caregiver. And so when we do the health coaching, we really focus on self-care. And caregivers really love that focus, that attention that they get during those self-care, during those health coaching moments that we have with them. And they really get a chance to focus on themselves for a few sessions with me. And we have REACH, which is Resources for Enhancing All Caregivers' Health. And those are coaching sessions too. And we work on problem-solving skills and stress reduction skills. And caregivers seem to really enjoy working on that because they learn to provide better care for their veterans through those sessions. And who doesn't like to solve problems and reduce stress? So those are some of the things we do through the Caregiver Support Program.
Hi, I'm Kimberly Gleiser, and I'm the Community Engagement Manager over at Hospice of Davidson County. So Hospice of Davidson County provides comfort care for those who are given a prognosis for 6 months or less. But we don't only just treat the patient, we treat the entire family unit. So we provide care for the caregivers as well. And so that is made up of a multi-discipline team of doctors, nurses, CNAs, social workers, our chaplain, and we also have bereavement services. And those services actually are free to the community. As long as you're experiencing some kind of loss, we can help you through that for free of charge. I'm trying to think of what else. That's usually like my 5-second elevator speech. Let's see, we are the only inpatient unit in Davidson County, and so that our Hinkle Hospice House provides respite care as well. And so if a caregiver needs a break for a little bit, we can take them into our Hinkle Hospice House and provide care so that caregivers can go away for a trip or whatever is needed. We also meet our patients where they are, so if you want to remain at home, we'll provide care at home. If they're in a nursing facility, we'll be there as well. And then of course we also have the Hinkle Hospice House, and that is for if a patient needs 24/7 care on the spot. We do have our 24/7 care line. If anything is needed, people can always call us no matter the time of day, and then we'll get someone out to you as soon as possible. But that 24-hour care that someone is there truly for 24/7 will be at the Hinkle Hospice House.
So I'm Nancy Earnhardt with Senior Services, and I do the resource and benefits. So basically, if you call in and have some questions about resources in the area, then I'm glad to help you connect with those, let you know what's available. And also, we have the Meals on Wheels program, and we have our own in-home services program that's grant funded, so that's free. That's for people that can't afford to pay for services but don't qualify for Medicaid. I will say that right now we have a waiting list, and it's a pretty long one because the need is so great, you know. But we do have that, and that would be through me. So if you're interested in the Meals on Wheels or the in-home, then call me, and we can do the application over the phone and get you at least on the waiting list, or your loved one on the waiting list. We also have senior transportation, where if you need to go to the doctor or the grocery store or pharmacy, you can sign up and go, and they do have a wheelchair lift. So if that's a problem as far as getting your loved one in the car, then you can use that. And I was going to show you, let's see, we have this community resource directory that we put out every year, and it just has some different resources in it that I'll have here at the table if you want to pick it up. It's online as well, but it just gives you some different nonprofits or government agencies that do different things. So there may be some things in there that would be helpful to you. And let's see, we also have lists of home care agencies and long-term care facilities that you're welcome to pick up if you're interested in that.
Well, good afternoon. We've officially crossed over to the afternoon. I'm Natalie Leary. I am a social worker at Duke with the Duke Dementia Family Support Program. So as our name indicates, we are a part of the Duke Health System, but the good news is that you don't have to be to use our programs or services. Our program was established in 1980, and our territory, if you will, has always been the state of North Carolina. So we have had the ability to work with folks regardless of their connection to Duke Health. And over the past 3 years with the pandemic, we've even been able to work with folks that are not even in North Carolina. So we have a lot of flexibility around who we're able to help. So our population, we work with those who are caring for someone who is living with changes in memory and thinking. That might be before a diagnosis, so maybe folks will call and say, we're noticing changes and we're not quite sure what to do next. Or we just got a diagnosis. Sometimes we call that diagnose and adios, right? Because the way the system is set up, there's not a lot of time in a medical appointment to really explain the ins and outs of a disease process. So folks might have follow-up questions from that appointment, all the way through sort of the trajectory of the disease. And so we work also with individuals who themselves have changes in memory and thinking. Our primary goal would be support and education. So support looks like some of what you have available right here locally through support groups. We do offer support groups on Zoom, have some in person. They're a bit of a haul for you all. They are in Durham, but we have a lot of groups that meet by Zoom. And we also provide one-on-one consultation. So families may have really specific questions about the disease process or new behaviors that are presenting, and they're curious about strategies that might be helpful in how they respond to those behaviors. And we do offer supportive counseling, which is a brief treatment model for folks who are in the caregiver role. Yes, you may have questions about the disease process, but also there's a lot of stress, there's a lot of grief, a lot of loss associated with that. So we provide brief counseling, which usually is about 10 sessions, and again can be by phone, in person, or by Zoom. And all of what we do, we're able to do at no cost to you or any insurance company. So we're able to dive right into whatever the presenting question or concern might be. We also are the central office, so Davidson County is included in that, for North Carolina's Project Care program, so it is available in all 100 counties. We just happen to be a part of the central team, very similar to Lifespan Respite that Nancy explained. It is a short-term respite program for someone who's providing care for someone living with dementia, and that person's at a point where they can no longer be left alone. So they require 24/7 supervision to be safe. and as a care partner, you would like a break, you need a break. So just like Lifespan, you get to identify who it is that you would like to hire, who you're comfortable coming into your home. Maybe that person needs skilled medical training, maybe they don't. Maybe it's your neighbor who's great with your family member and you're comfortable with them. It's a great program because there's the flexibility for you to decide who you want to hire. As we're wrapping up the state's fiscal year, that funding has been exhausted for this year, but we will receive additional funds in the summer. So in the interim, we also have been applying folks to Lifespan Respite. So there is some respite opportunity available. Let me pause there. I know that's a lot of information coming at you. So let me check in. Any questions that you all might have? Well, if you think of any, I will be at the table. Thank you all for having us today.
My name is Lisa Matney, and I'm with Supportive Care Solutions, and we manage the CAP-DA program. And CAP-DA is the Community Alternatives Program for Disabled Adults. So we are a Medicaid program, and it is for people 18 and older who need nursing home level of care. Excuse me. So the services that we provide, we can have in-home aid come out. We do equipment modification, home modifications, grab bars, bathroom modifications, the wheelchair ramps, things like that. If you're on CAP, Medicaid will pay for a personal emergency response system, you know, the lifeline button that you can press. We can also pay for nutritional supplements such as Boost or Ensure. There's some incontinence supplies that are covered by Medicaid that we can provide as well. Yeah, there's a couple different options if someone's on CAP. There's one called coordinated caregiving where a live-in caregiver can get a monthly stipend. There's another option you can choose if you're on CAP where you wouldn't have to use an in-home aid agency. You can hire somebody yourself, and it's called consumer direction. So that's where you can hire a family member to be paid to take care of someone. There was a waiting list for CAP, but there's not right now. Because Davidson County did have a waiting list, other counties that weren't using all their slots, they let us take some of those slots. So right now we're serving, you know, a lot of people, and there is not a waiting list if you are interested in that. And I do want to mention there is a program called MFP, and that's for people who are already in a facility who want to come home. So they will help you transition back home, and then you can either get PACE or CAP services. So if you know somebody's in a facility that wants to come home, they can sign up for that program.